Today we are going to discuss about medical coding free webinar. We are inviting Harish Gupta. I'll be giving a small intro about him. He is a 10 years experience certified medical coding professional. He is a certified by AAPC and he is a content creator of Fast Coder 21 YouTube channel. He is also a process trainer at leading US based medical coding organization. Also he helped 100 plus students to place their dream job. Also, he's a qualified BSc biochemistry professional. He done PG diploma in QT, MBA and MA English. So in this session, we are going to discuss about the introduction of medical coding. Also, we'll be discussing about the career opportunities in medical coding. Also, if you have any questions, any queries, you can add the questions in the chat box. We'll be answering all those questions in the live Q&A. So, Harish Gupta sir, please share your screen and help us understanding what is medical coding and everything.
Thank you, Sai Kiran. Thanks for your kind words. So I am starting sharing now. So thank you guys. Thanks for attending this webinar. So as all of us know, nowadays there is a huge demand for medical coding field. So as Sai Kiran told, I have nearly 10 years experience in medical coding and I have coded all the specialties in medical coding. So currently I am the content creator for FastCoder 21 medical coding YouTube channel. So today our main session is medical coding marathon. In this session, you are going to learn so who is a medical coder and what is medical coding, what are the requirements to learn medical coding, what are the certifications are involved in medical coding, so how to get your job. So all those topics we are going to learn now. So what is medical coding? So medical coding is the transformation of healthcare diagnosis, procedures, medical services, and equipment into universal medical code alphanumeric codes. The diagnosis and procedures codes are taken from medical record documentation such as transcription of physician notes, laboratory and diagnostic or radiologic results. So basically in easy words, medical coding is the transformation of diagnosis and procedures into alphanumeric codes. In medical coding, we have two types of code sets and we are going to know all those code sets soon. So in order to code our medical coding, we need to take our contain diagnosis and procedures from the transcription of physician notes, laboratory and radiologic results. So
Okay.
basically medical coding is the transformation of diagnosis and procedures into alphanumeric codes which are valid all over the world. So medical coding is also different for different countries. So mainly in India, we are doing medical coding for USA. So we have nearly 7 countries are conducting this medical coding process. And most of the time, USA medical coding is used by UAE and India. And also we have medical coding process in like Pakistan as well as Nigeria and Singapore, Australia and Canada. So if you are anyone planning to go to all those countries, please contact us after this webinar. So basically, you will take all the diagnoses and procedures from the physician notes as well as the laboratory and radiological results. And who is a medical coder? The obviously the coder or person who will code medical records is medical coder. So medical coders help ensure the codes are applied correctly during the medical billing process, which includes abstracting the information from the documentation, assigning the appropriate codes, and creating a claim to be paid by insurance. So who is a medical coder? Basically, as a medical coder, we have 3 steps. First step is we need to abstract the information from the documents. Okay. Next step is to, after abstracting the information, we need to assign the appropriate codes. Now, third step is we need to send all these codes to the insurance carriers. So basically, we will not do all this insurance process. Other team will be available. They will do insurance process. Our main task is here abstracting the information and assigning the appropriate codes. So those are two are the important codes as a medical coder. So medical coders translate documentation to standardized codes that tell payers for the following. So by assigning the appropriate codes, what does the payer is going to know? Here, based on our codes, payer is going to know patient's diagnosis. For example, patient has hypertension. So we will not keep hypertension in the documentation. So for example, if you take hypertension, we need to code I10. So I10 is the standardized code which is formed by the World Health Organization, but each and every country has their separate rules for this diagnosis process. So patient diagnosis, we will tell the payer. So what is the reason for the patient's visit? So next, medical necessity for treatment services or supplies the inpatient received. So basically, whenever we will perform any type of procedure or treatment, we need to provide the medical necessity. For example, patient came into the hospital. Okay, patient has hypertension, but if you code like fracture, repair of the fracture, so there is no medical necessity from the diagnosis as well as the procedure. Why? Means patient came in for hypertension, but you have coded as a procedure fracture repair. So there is no relation between hypertension and this one, like fracture repair. So always, in order to get proper payment, we need to ensure medical necessity between the diagnosis coded as well as the procedure. So that is the medical necessity. Next, treatment service and supplies provided to the patient. So here also we are going to provide all the treatments. For example, patient came into the hospital for cast insertion, like cast or strapping. So for those cast and strapping also we need to code. So soon we are going to know what are the code sets in the medical coding. You no need to worry. So any usual circumstances or medical condition that affected those treatments and services. So basically, we need to provide the any unusual circumstances using the medical codes. For example, physician has started the procedure, but due to patient's condition or any type of technical difficulty, physician will stop the procedure. That time we need to provide the payer stating that. So we need to provide one code. Using that code, provider knows that or payer knows that your physician did not complete the procedure completely. So like that, we need to provide unusual circumstances or medical condition that affected those treatments and services. So this is about medical coding and who is a medical coder, routine tasks of a medical coder. Now we will learn when does the medical coding happens. So basically, first, as soon as the patient comes into the hospital, pre-registration will be happen. So registration of the patient done by the registration people or front service desk people. As soon as the front service desk people completes their task, they will send patient to the physician. So after performing the physician his work or her work, they will document the transcription report. There we need to acquire and take those transcribed report from the patient or physician, and we need to code it. So basically medical coding happens every time you see a healthcare provider. So in India it is not mandatory to have this documentation, but in US it is mandatory. So if in order to get insurance, medical coding is very important. So medical coding happens every time you see a healthcare provider. The healthcare provider reviews your complaint and medical history, makes an expert assessment of what is wrong and how to treat you, and documents your visit. So as soon as you see the physician, he will check your past history and your family history and present situation which necessitated to you to admit or attending in this hospital visit. So the documentation is not only the patient's ongoing record, it is how the healthcare provider gets paid. So based on the documentation which is provided by the physician, we will code the document, and based on our codes, physician will get the payment. Next, what are the types of codes used in the medical coding? So in medical coding, mandatorily we will use three types of code sets. First one is ICD-10-CM. So usually we will call it as International Classification of Diseases 10th edition clinically modified. So which is published by CMS. So basically this is the diagnosis codes. ICD-10 CM is for diagnosis codes. For example, patient has throat pain. So throat pain is a diagnosis or procedure, guys?
Diagnosis.
Yeah, for
Diagnosis.
Diagnosis, sir.
Yeah. So for those diagnoses, we need to use ICD-10-CM. For example, if the patient has hypertension, we need to use ICD-10-CM. For example, patient has abdominal pain, we need to use ICD-10-CM. For example, patient has any type of cancer, we need to use ICD-10-CM diagnosis. So basically, here you need to understand that for diagnosis or any type of conditions, you need to use ICD-10-CM. So it is having approximately 69,000 codes. So this ICD-10 CM is updated by every year. So every year we need to know all the updates while coding ICD-10 CM. Usually ICD-10 CM updates will be available on October 1st. So October 1st onwards, we need to use latest updated ICD-10 CM guidelines. So basically ICD-10 CM is having 7 characters. So among those 7 characters, we need to code the like diagnosis. So next one is CPT. So basically CPT is current procedural terminology. So which is maintained by American Medical Association. Usually we will call it as AMA. So it is having nearly 8,000 5-character alphanumeric codes. So basically CPT is a procedural coding. For example, patient came in for what do you call abdominal pain. So patient is undergoing colonoscopy. So what do you think? Colonoscopy is a procedure or a diagnosis?
Procedure, sir.
Procedure, sir.
Yeah, correct. So for those procedures, we need to use CPT, current procedural terminology. See, most of the time CPT is used by the outpatient coder. Soon we are going to know who is outpatient coder and who is inpatient coder. Okay. So next one is ICD-10 PCS. So this is usually we'll call it as International Classification of Diseases 10th edition procedural coding system. So PCS means procedural coding system. So basically ICD-10 PCS is used by the inpatient coders. So as I have told you previously, we have outpatient coders and inpatient coders. So next we are having modifiers. These modifiers are mostly used by the outpatient coders along with CPT codes, which are current procedural terminology, or along with these 8,005 character alphanumeric codes. We need to use these modifiers. These modifiers are 2 digits code alphanumeric codes. Okay. So next one is MSDRG. So basically, whenever patient admits as a inpatient, we need to use MSDRG system. So usually we'll call it as Medicare medical severity diagnosis related groups. So based on these MSDRG, inpatient hospitals will get the payment. Okay. So these MSDRGs are developed by Centers for Medicare and Medicaid Services. Usually we will call it as CMS in US. So CMS is the public organization. It works under government. Next one is ambulatory payment categories. So this is for outpatient coders. So basically APCs are maintained by CMS again. So these support hospital outpatient prospective payment system. So usually we'll call it as OPPS. Okay. So in APC ambulatory payment categories, for example, if the patient performs any type of fracture repair. So fracture repair, any type of repairs in outpatient setting using these APCs, patient will get the payment. Using this MSDRG, inpatient physician will get inpatient specialties. So this is the medical coding process. Okay. So first of all, as soon as the physician see the patient, he will provide the charts. So as a medical coder, we need to assess those patients' chart. Then we need to provide pre-coding. So what is pre-coding? So in pre-coding scenario, we need to check the proper client guidelines related to that chart coding. For example, in US, we have multiple payers. So whenever we code any chart or any type of medical coding, no worries guys, I am going to help you as much as the information needed by me or you need from me. So next one is pre-coding. As I told you before, whenever you code a medical coding chart, you need to know the payer guidelines. So why means in US we have private payers as well as the government payers. So the rules for private payers as well as government payers are different. So we need to check while coding any record, these guidelines are payer specific specifications. Next is after checking the pre-coding like formalities, we need to code CPT and ICD-10 CM coding. Using our code sets, we need to code our medical coding chart. Then we need to send our report to quality audit. So as if you are a coder, you need to send your medical record to quality auditor. So the person who is experienced in the medical coding, they will become quality audits. And then after completing quality audit, the submission of coded charts will be done by the other people where those people submit these coded medical coding charts to the insurance payers. So this is the 5-step process. First one is assigning, accessing patient charts. Next one is pre-coding. Next one is CPT and ICD-10 CM coding. Next, quality audit. Next, submission of coded charts. Most of the time, we will not need to worry about this one, submission of coded charts. So just we need to concentrate mostly on these 4 steps: assessing patient charts, pre-coding, CPT and ICD-10 coding, and quality audits. We don't need to worry about this 5th step, submission of coded charts. Okay. So the other people will do this process. We don't need to worry as a medical coder. So these 4 are the important tasks for us. So next, very important, how do you become a medical coder? So in order to become medical coder, you need to have good understanding of anatomy, physiology, and medical procedures, and payer rules and policies. So in order to become a medical coder, you need to have good understanding of medical terminology and medical coding process. So you are having, for example, you have nowadays you are having free resources using the YouTube. So currently our Fast Coder 21 is India's topmost medical coding YouTube channel, where I will provide all the information related to medical coding. So in order to know code medical coder, you need to have good understanding of anatomy, physiology, and medical procedure. So in medical coding, so for example, you are a medical coder, like you are a healthcare professional, you don't know anything about medical coding. If you want to change into medical coding, first of all, you need to have good anatomy and physiology knowledge. So you need to ensure that, so you need to confident that I have good anatomy and physiology knowledge. Next, you need to think about the basic medical coding training. So if you are having good anatomy and physiology, you need to take basic medical coding training. There you are going to know what are ICD-10 CM codes, what are CPT codes, and what are ICD-10 PCS codes. Those are basic medical coding training. You need to understand or undergo those training. So after you have this basic medical coding training, you need to take certification from AAPC or AHIMA. So basically, CPC is the most common certification for medical coder. So CPC's full form is Certified Professional Medical Coder or Certified Professional Coder, which is provided by AAPCs, which is a worldwide organization. Even we too have in India also, they are having the office. So if you want to enter into a medical coder, after completing your basic medical coding training, you need to complete your CPC certification. So we will provide all types of certifications, basic medical coding, CPC certification, all types of certification trainings we will provide. So in industry, we have 2 types of certification. For outpatient coders, we have CPC is the basic certification. So inpatient coders, CCS is the basic certification. So for outpatient coders, mostly use ICD-10 CM and CPT. Inpatient coders will use ICD-10 CM and ICD-10 PCS. Anyway, we are going to see all those here now. So this is the difference between outpatient and inpatient coding. Okay. So here physician or outpatient coding, facility or inpatient coding. So as we know here or we are seeing here, ICD-10 CM for diagnosis is common for both outpatient and inpatient. So if you are a medical coder, you must need to know ICD-10 CM for diagnosis. So as it is common for outpatient coding as well as the inpatient coding. So in outpatient coding, we will not code probable, suspected, or rule out conditions. Okay. In inpatient coding, we will add, for example, in the documentation, physician will tell probable cystitis. So can you code in inpatient coding, guys? Can you code in outpatient coding? So where do you code if the patient tells probable?
Inpatient.
Yeah, correct. So outpatient, we will not code any type of uncertain diagnosis. In inpatient, we will code any type of uncertain diagnosis like probable, suspected, suggested, like all those conditions we will not code in outpatient coding. So next one is, as we discussed previously, in outpatient coding, we will use ICD-10 CM as well as CPT. So in inpatient coding, we will use ICD-10 CM as well as ICD-10 PCS. So mostly you need to understand that in outpatient coding, in order to code procedures like cholecystectomy, like AV fistula creation, all those procedures, we will use CPT and HCPCS level 2 codes. In inpatient coding, we will use ICD-10 PCS codes. Okay. So here, who will use both ICD-10 CM, guys? Who will use outpatient coding or inpatient coding? Who will use ICD-10 CM?
Both.
Yeah, correct. Yeah, why means this is the basic code set which need to be used by the all type of medical coders, outpatient medical coders as well as inpatient medical coders. Okay. So in outpatient coding, reimbursement primarily based on physician fee, insurance contracted rates, ambulatory surgeries center rates. So we have seen APCs, correct? Ambulatory payment classifications. Based on those, outpatient coding departments will get money. So in inpatient setting, reimbursement primarily based on the diagnosis related group. So we have seen previously, correct? So in inpatient, MSDRG, in outpatient, APCs. Okay. So outpatient coding, patient no need to stay in the hospital. So for example, patient comes in hospital in the morning like 10 o'clock or 11 o'clock, he will leave before 5 o'clock. So there is no mandatory to in order to stay in the hospital in outpatient coding. Whereas in inpatient coding, hospital stay minimum 2 day minimum. So if the patient is going to 2 day minimum in the hospital, we need to consider it as inpatient coding. For outpatient coding, it is only 1 day, like 24 hours stay only. We will call it as outpatient coding. It is more than 2 days. We will call it as inpatient coding or inpatient stay. So next, code assignment is based on the encounter or visit. So for example, in outpatient coding, so what is the length of stay, guys, in outpatient coding? 1 day or more than 2 days?
One day.
Less
Yeah,
than
One
correct.
day.
one day.
Yeah, in outpatient coding, patient needs to stay only 1 day. In inpatient coding, more than 2 days. So here in outpatient setting, code assignment is based on the encounter or visit. For example, patient came into the hospital on like January 5th. This coding or payment based on those 1 day only. Okay, whereas in inpatient, for example, patient stayed for 3 or more days. So here in inpatient coding, so payment is depends on these 3 days. As much as long as the patient stays in the hospital, based on that in inpatient coding, physician will get the money. So in outpatient coding, only 1 day visit. In inpatient coding, it is based on the length of stay of the patient. Next, in all outpatient coding procedures are used by CMS 1500 form. So whenever you are going to see or you are going to apply outpatient codes like ICD-10, CM and CPT codes, we need to use CMS 1500 form. Whereas inpatient coding, we need to use UB04 form. Okay. So this is the difference between outpatient coding as well as inpatient coding. So this is all, guys. So if you this is your turn now. So Sai Kiran, I am done with this.
Awesome, Harish sir. It was pretty much clear about medical coding.
Yeah, thank you, Sai
Uh,
Kiran.
Guys, if you have any queries, please ask questions to Harish sir. Or else, if you can comment down in the comment section, we will answer those questions. Or else, you can directly ask.
Sir, what is the fees for the courses for the certified coding and then for the basic medical knowledge coding before the certified coding course?
So basically, it is based on the institute from our channel, Fastcoder 21 YouTube channel. So it is based on the time and students. So if you are interested to take any type of training, just you send your request to vincentmedicalcoder@gmail.com. As soon as we finalize the fees using Swasa and Fastcoder 21 YouTube channel, we will mention in our YouTube channels. Okay.
Yes, John. John, we'll be sharing you all the details in couple of minutes, or else by Monday. Uh, please go through the form and fill out those details. Then
Yeah,
we'll be
fill those details so that we will contact you as soon as possible.
Sir, after the training, what are the usual working hours? How many hours per shift and which time zone are we?
Yeah. Basically, that is a good question. Basically, so in medical coding also we have like 24 hours shifts. So for certain specialties, you need to work in morning time. Okay. For certain specialties, you need to work in evening time. For example, in medical coding, we have denial management coding. Okay. So if you are a denial management coder, most of the time you need to work in the night time. Why means our night is daytime in the US, correct? So as a denial management coder, you need to tell the payer that So these are the code coded by our coder, but you did not agree these codes. So you need to explain to the payer that the reason for assigning those codes. If you are a denial coder, you need to work in the night shift. Whereas if you are working as a like inpatient coder, surgery coder, SCC coder, so you need to work in the daytime only. So basically, it is based on the company, guys. There is no fixed like that. Only you can work as a day coder like that. So it is based on the company. So initially, if you start as a medical coder, it is better. You can learn more things in the night time only. You can work in the night time and you can come into the daytime job. But based on my knowledge, 90% daytime jobs only in medical coding. 90%.
Sir, are we doing transcribing of the physician assistant note? So, like for example, when the patient is being seen by the doctor, are we going to process the coding immediately when the patient is being the note is being made, or it's already recorded on the system and we are processing it after the day's work?
No, it is based on the payer. Whenever they will release the coded chats, we need to code. While coding, we need to check the soft copy only. So we will get the PDF or any type of encoder. We will get. We will get the like documentation. We need to take that documentation and we need to code. We will not get any audio type device or audios in order to code the chart. So we will go
So
like
we will go
PDF
like PDF.
So we are coding only
Coding
from.
only from.
documents.
Thank you.
Welcome.
Sir, is there any company which is hiring non-certified freshers at present, sir?
So
So
currently,
currently,
I think
I think
Saikiran,
Saikiran.
it is echoing now.
Is there any company hiring non-certified freshers at present, sir?
So it is
So it is.
sure that, but to people are trying and people are entering into medical coding non-certified. It is not a problem. You can try. You can try.
No, sir. Is there any company hiring
No, there
No,
is
non-certified?
no,
no
there is
separate
no
company.
separate.
Whenever there is a requirement, they will hire. For example, if you take Optum, you know Optum.
Yes, sir.
So
So
sometimes they will
sometimes
take
they will
based on
take
their
based on
requirement,
their
but
requirement, but
again echoing.
again echoing.
Saikiran. So some companies will take non-certified coders, but MNCs will not take the non-certified coders. The thing is that companies will take the non-certified coders also. For example, certified if the certified coder gets 12,000, non-certified coder gets 8,000. So if you are compromised with your salary, you can work as a non-certified coder. So there is a difference between your salary only, nothing else. So if you don't have the certification, like companies will give very less salary. If you are having the certification, you will get more salary. Why means if you are having the certification, so Indian companies will show to US payers stating that we have all certified professional coders, so that we need more money like that. So you can try as a without certification also. There is no restriction on that. But you need to
So,
compromise your salary. Yeah, go ahead, Jan.
sir, what if we don't want to stay in India and we want to work, but do we still have to be in India when we are working for the US company?
Yeah, of
Like,
course.
no. I mean, like, for example, can we be staying in another time zone but still be working for the company?
So our work timing is mostly IST only. So we no need to worry about their timing. In medical coding only, as all of us know, revenue RCM, you know RCM, na? Revenue cycle management. So in
Uh,
RCM, we have different types of jobs. As a medical coder or medical, if you work in a medical coding company, you need to work in IST only. You no need to worry about their time.
okay, sir, thank you.
Good evening, sir.
Yeah, go
After
ahead.
graduation, we should learn medical coding, or else after 12th we can.
So basically, minimum qualification is BSc Life Science. So you need to have your intermediate qualification that is sufficient. So most of the time you need to have life science background so that company will hire you easily. Why means medical coding completely depends on diagnosis and procedures, correct? So if you are a life science student, companies will hire you easily. So if the life science guys and non-life science people will go, company will prefer you life science students, not irrespective of non-life students. So you need to have lifetime students in order to join as a or work as a medical coder.
Okay, sir.
Sir,
Thank
what
you.
is the duration of this course, sir?
Sorry.
What is the duration of this course, sir? Medical coder.
So yeah, basically it is so as our Sai Kiran told, just send your details to Sai Kiran, so he will guide you wherever you need. We will contact you. So
Thank you.
basically, this training is common, not common for each and every course. Okay. For example, if you take basic medical coding, approximately it consists of 15 days. Okay. For example, if you want to write CPC certification, you need to have 2 to 2.5 months duration. Like that, it is based on the certification. So there is no constant rule that this time is sufficient for learning medical coding.
Okay, sir. Thank you, sir.
Yeah.
Sir, what are the commonly asked
Excuse me,
interview
sir.
questions?
Yeah. Go ahead, Praveen.
Sir, I have completed graduation in geology. I have
Okay.
not certified in medical coding, but I have knowledge in medical coding.
Okay.
Can I get job, sir?
Yeah. Of course, you can try. No problem. So no one will restrict you to apply.
Okay, sir.
So there is no restriction. So if you want jobs, you can check our Passcoder 21 YouTube channel and Swasa also. Swasa also, they are providing medical coding jobs, and Passcoder 21 is exclusive for medical coding. So we will provide all types of medical coding related information in our channel. So you can follow our channel and you can apply for the job. So basically, there is no restriction stating that like freshers will not apply for this job. Anyone can apply. Basic requirement is you need to have life science background.
Okay, sir.
Thank you, Harish Kumar.
Yeah.
Also,
Yeah.
we got
Uh-huh.
few messages from the candidates. Archana is
Sir,
Yeah.
can
asking
you
that
send me your YouTube channel, sir?
it's a
Link.
Fast Coder 21, Praveen. You can go and check on YouTube. Also, we'll be sharing
Okay,
all
okay, sir.
the
Thank you.
links in the email. We'll be sharing you a couple of minutes.
So I think I have it here. So I
Right.
will post in the chat box here so that you will know. Yeah, this is the YouTube channel. So we are going to learn all the information related to medical coding. So what are the questions? So Saikiran, can I read all these questions? Will
Yeah,
you
yeah,
read all the
please.
questions?
I'll ask questions. Please answer the
Yeah,
questions.
no worries. Go ahead,
So,
Saikiran.
Archana is asking about is medical coding only for fresh graduates or experience also can be applied?
See, basically the thing is that everyone works for salary, correct?
Right.
So freshers will work for minimum salary. For example, if you are having other type of healthcare experience, so your salary is more there. So if you want to compromise with your salary, you can come into the medical coding. Okay. So you need
Okay.
to sacrifice yourself. So and you need to compromise your like your salary. So that is the criteria. But there is no restriction that only few people will can do medical coding. Not like that. So everyone can do medical coding.
Harish sir, like if we can start career as a fresher, then eventually we can done certification, then we can go for other jobs. Correct?
Yeah, of
Then we
course.
can. Yeah.
Yeah. So basically, whenever you want to start as a medical coder, basic first requirement is life science graduate.
Right.
Next requirement is you need to have understanding or you need to undertake basic medical coding training. So after that, third step is you need to complete your CPC certification. So
Okay.
after completing your CPC certification, you can try for any type of job, like whether if it is outpatient coding or inpatient coding. So you can try for any type of job.
Okay, sir. Thank you. Understood. And
Welcome.
we have one more question from Faiz Khan.
Okay.
He's asking about is medical coding useful for D pharmacy students or
Yeah, of
can?
course. So, Sai Kiran, nowadays, even except even MBBS doctors also coming into medical coding. So, I have few students from US. So, they have done their physiotherapy. Okay.
Oh,
And some people are done homeopathy. So, all those people are coming into medical coding. So, everyone can do this medical coding. So, there is no restriction.
also from Vamshi, BSc Maths, Chemistry, Computer Science. He is a graduate candidate, so he's eligible for this course. He's asking.
Yeah, yeah. So basically, the thing is that it's everything depends on the company. Why means nowadays there is a huge competition for medical coding. Why means it is 9 hours job as well as weekly 5 days job. So nowadays people are not taking non-life science candidates like this maths, physics, chemistry, like those candidates. But if you are a life science graduate, you are having the more opportunity compared to non-life science graduate. So I don't tell that you can't try for medical coding. You can try. So it is
Also,
based on the company.
geology graduate also can be.
Yeah, of course. Zoology comes under life science only. Correct.
Right, right.
Hello, sir.
Yeah,
Sir, I have completed diploma in pharmacy and parallel DMLT. Can I eligible for this?
of course, 100%.
But sir, how can I apply?
So as we told previously, you need to undergo basic medical coding training first.
Yes,
Then
sir.
you need
Sir,
to.
I have completed medical coding training.
Okay, then you need to complete your CPC certification and you can try. As I told before, you need to follow
Without
SWASA and
CPC,
first.
I can't apply.
Sorry.
Without CPC, I can't apply for this.
Yeah, you can apply. No problem. So I am telling you
But
now,
at
there
which
is no
company?
restriction. The thing is that, for example, if the company get 10 CVs, okay,
Okay, okay,
so they will get 7 CVs with certification, 3 CVs with without certification. So
okay,
they will prefer only these 7 CVs. Why means
okay,
they are having the certification, correct?
okay,
So that is
Yes,
the
right.
simple reason
Companies will only shortlist those candidates who is
who are
qualified
having
and
the
certified from.
certification.
okay. Thank you.
But yeah, other than that, there is no restriction that non-certified coders or non-certified people will not apply medical coding jobs like that. So you can apply. There is no restriction. If you want to create your priority, you need to have your certification.
Okay, sir. Thank you.
Yeah,
We
go ahead.
got one interesting question from Gyan Prakash. Is there any effect of artificial intelligence on medical coding?
So currently there is no effect. So there is no effect of artificial medical coding. So why means mostly if it is possible diagnosis codes may AI will replace, but based on these procedures AI will not replace. Like as we discussed previously, for outpatient coding we will use CPT, correct? For inpatient coding we will use, what do we use guys for inpatient coding for procedures? So for inpatient coding we will use ICD-10 CM. So these procedures, yeah, correct. Thank you, Smita. So these procedures can't be done by the AI. For nothing, it is not in our hands. But in order to get survive from the AI, you need to have master in all type of medical coding specialties. Okay. So you need to work as a inpatient coder as well as the outpatient coder. So that is the secret.
So what are the commonly asked interview questions for freshers?
Yeah, you can check our Fast Coder 21 YouTube channel. We have nearly 150 videos. So you can find answers from there.
Okay, sir.
Yeah. Thank you, Mesh.
Also, we have one more question.
Yeah. What is your question?
Hello, sir. I'm a certified candidate recently.
So I can't hear you properly, basically.
Hello, sir. Recently, I've qualified for
You can
CPC.
drop your.
Okay.
Can I can I work in America or Dubai as a fresher, or should I get experience in India for some years?
So if you want more information, please check Fast Coder 21 YouTube channel. We have created 7 countries videos: USA, UK, Canada, Australia, Singapore, UAE. Okay, you can visit Fast Coder 21 YouTube channel where I have provided all the information related to these countries. So you can check Fast Coder 21 YouTube channel. You will get every information, whatever you want.
Okay, sir. Okay.
Yeah, go ahead, Saikiran.
Yeah, we have few questions like regarding the salaries. The starting
Okay.
salary for the fresher or else 0 to 2 years experience candidate. What is the basic salary?
So basically, it is also depends on the company. So
Right.
we have, as all of us know, we have small companies or multinationals. So in small companies, they are giving 12,000 to 15,000. Okay. In multinational, they are giving minimum 18,000, 18 to 25. If you are planning to work as a fresher.
Okay. I think Ramadevi raised her hand. You can go ahead ask your question, Ramadevi.
Hello, sir.
Yeah, go ahead.
Sir, one question I have.
Okay.
Sir, I had done a diploma in radiology. Okay.
Okay. Yeah.
And I have a minimum 1 year experience in hospital. Okay.
Okay.
In as a radiology technician job, I cannot get any job. Okay. So I
Okay.
apply for this course uh, for further any job or not? And
Yeah, yeah,
what
of
is
course.
the
So as I told you before, so you are
yes,
you worked as you are having the radiology certification, correct? So you are having
yes,
the radiology knowledge. So in
yes.
medical coding, we have radiology specialty coding also. Okay, we will
Okay,
usually call it as radiology coder. So for
okay,
that also basic qualification is life science, and as well as you need to have CPC certification. After you complete your CPC certification, you can apply for radiology coder. 100% you will get the job. Why means you are already having the radiology experience, correct?
yes, sir.
So companies will prefer you.
Okay. But sir, after diploma course, any course need for this job or
Yeah,
others
you need
hospital?
to. Yeah, you
Huh?
need to have the CPC certification. That is
CBC
mandatory.
certificate. Okay, sir. So this course, CBC certificate, how much cost, sir?
So as Sai Kiran told previously, just Sai Kiran, how are you going to collect their information?
We'll be sharing the email with them
Okay,
with the all the details about course fee, course
okay,
duration, and all the details.
okay.
You can
Okay,
Yeah,
register, guys.
yeah. You can register, guys. Send whatever the Sai Kiran told the email. Send your details to that email. We will contact you one by one for
okay, sir.
information regarding trainings.
Okay, sir. Okay. Thank you, sir.
Yeah, welcome.
Yeah, we have one more question. When everyone, the companies they are talking about, is switching into automation, what is the future of medical coders?
So there is no threat to medical coder. Why means currently in India, people are stopping medical coding at 40 to 45 years. I have few friends from USA. Their age is 65 years. Still they are working as a medical coder. So everything depends on you guys. So as I told you previously, if you want to survive in medical coding after AI also, you need to have good knowledge about all specialties like outpatient coding as well as the inpatient coding. Even though AI will do the medical coding, as a senior medical coder, you need to audit all these cases. So you need to have mastering medical coding all the specialties. If you are having the good understanding of medical coding all specialties, there is no threat with AI.
Okay. Also, we have one more question. Like, in the market, we have less salary around 10,000 to 15,000, 12,000. And
Okay.
what is the future expectation? Like, how much can expect around 5 years or 6 years candidate?
So everything depends on you only. So we can't finalize this much salary you will get like that.
Okay.
So I mean, for example, in medical coding, so this is a good question basically. In medical coding, we have inpatient and outpatient coding, correct? So
Yes.
inpatient coding comparatively, like coders will get more salary. So in outpatient coders will get less salary. So, but inpatient coding is a little bit difficult and you need to have good patience. So, but in outpatient coding, we have multiple specialties. So we have emergency department coding, okay, surgery coding, SCC coding, and as well as anesthesia coding, radiology coding, pathology coding. So all this comes under outpatient coding. In inpatient coding, we have only one, that is inpatient coding. So it will get more salary, but it is having your patience and your interest towards the coding.
Okay.
Yeah.
Also, we have few more questions about work from home job opportunities. Like, how can we work? Like, are the companies looking for work from office or work from home jobs? Rishabh?
Yeah. So now there is no possibility for work from home jobs, guys, frankly. So
Okay.
initially they will give 1 or 2 months for work from home in order to train you based on this that particular company. But afterwards they will call you to office. but mostly few companies are giving inpatient coders for work from home jobs. In here, outpatient coding also for surgery coders, they are giving work from home jobs. So only two people will get the chance, like inpatient coders as well as the surgery coders. So they are having the work from home opportunities currently.
Okay. So, is there any, what is the difference between medical billing and medical coding? And if medical billing experience has, someone can work in medical coding also?
Yeah, of course. I think most of the time, so after completing medical coding, medical billers will enter all those codes in the encoder or any type of client system. So I think medical billers have sufficient knowledge about the medical coding. So they used to see ICD-10 CM codes, CPT codes, and PCS codes. Of course, medical billers can do medical coding. So there is no restriction.
Okay.
Yeah.
Do we have any age limit for coding jobs, or we don't have any?
So that is also very tricky question. It is everything based on company. Okay. So, but as such, there is no age restriction. So, as I told you before, in US, people with 65 experience, 65 years also working now. So, there is no age restriction, frankly. So, if the
Okay.
company takes, you can work.
Also, Srinita is asking about, she has completed CPC certification. So,
Great.
what is the best department to join, like surgery, EM, ED, or etc.?
So, it is as a fresher medical coder, if you are completed your CPC certification, don't choose the specialty by yourself. Okay. So, you need to apply and you need to join in the company, whatever the specialty you will get. Don't choose by yourself. Why means there is a huge competition for medical coding. Nowadays, getting opportunity is very difficult. So you don't need to worry about the specialty. You need to try about entering into medical coding company.
Okay. Also, the chat
Excuse me,
GPT.
sir.
Yeah, go ahead.
Yes. Shobha.
Sorry for interrupting, sir.
No
Good
worries.
evening, sir. This
Yeah,
is Shobha here, sir.
yeah, go ahead.
Uh, I certified, sir. It's last August month
Okay.
CPC, and I have 2 year experience. Looking for medical code job and work from home. A surgery coder, sir. I am surgery coder, and I'm staying in Vizag.
Okay.
So actually, you told no, they are giving surgery coder work from home. That's why I asked you.
So are you working in Vizag now?
No, no, no. I'm releasing.
Okay, okay.
So 2 year
So
experience.
in surgery coding.
Yes,
So
sir.
where did you work?
Sir, yeah, that's Pinna 4 medical coding company here in Vizag.
So, okay. So, if you want to work as a medical coder, you need to follow Swasa for medical coding jobs, and you
Oh,
need to check our channel, Fast Coder
yes.
21.
So Shwasa, actually, I think it's Hyderabad. This.
Yeah, yeah,
Yes, yes,
Hyderabad
Shobha.
only. Yeah, both are from Hyderabad only.
Okay, then what about they are giving work from home or not?
Shobha, Swasa is a platform. All the recruiters will post jobs on our platform. Then
Okay,
once you apply for those jobs, recruiter will get notified. They'll give you a call back.
okay, sir.
Okay. Also, we'll be sharing you all the links which are actively hiring job opportunities. You can go and apply for those jobs.
Okay,
Yeah.
sure, sir.
So, always try to follow Fast Coder 21
Thank
and
you, sir.
Swasa. You are going to get all the latest updates about medical coding jobs.
Yeah. So, Hari sir, like this chat GPT will affect medical coding. It is beneficial for the medical coders.
No, no, there is no threat with Chat GPT. Why means every year medical coding will change. So there is no problem with Chat GPT.
Okay. How to move
सॉरी
abroad
सर
with certification? Yeah, Smita, go ahead.
हाँ सर मुझे ये पूछना था सर अभी
Yeah.
मेडिकल कोडिंग का सर्टिफिकेशन हो जाएगा कंप्लीट उसके बाद कितना टाइम लेना चाहिए सीपीसी एग्जाम देने के लिए जब अगर जॉब मिलने के बाद तुरंत देना चाहिए एग्जाम की कुछ समय लेना चाहिए और कितना लेना चाहिए सर ये मेरा क्वेश्चन है
देख फर्स्ट आप क्या करेगा आपका बैकग्राउंड कौन सा है
सर मेरा एमएससी केमिस्ट्री में हुआ है
ओके ठीक है। तो फर्स्ट आप बेसिक मेडिकल कोडिंग ट्रेनिंग लेने का, ओके। उसके बाद आप सीपीसी सर्टिफिकेशन लेने का, उसका भी ट्रेनिंग रहता है अलग। सो एक बार सीपीसी सर्टिफिकेशन कंप्लीट हो जाएगा ना, आप जॉब के लिए ट्राई कर सकते हैं। सो ऐसा गैप ड्यूरेशन नहीं है, वो आपका मर्जी है। आपका आपका पास पैसा रहेगा तो तुरंत कर सकता है सर्टिफिकेशन। सो आपका पास पैसा नहीं तो थोड़ा टाइम लगेगा।
Okay, sir. Thank you, sir.
वेलकम।
Alekia is asking about like how to move abroad and which certification is needed for the moving abroad.
Yeah, as I told before, we have multiple videos related to USA, UK, Canada, Australia, Singapore, UAE on Fastcoder 21 YouTube channel. You can go there and search.
Okay.
Okay, I have provided clear information regarding all these jobs, medical coding jobs in all these countries. You can watch, and if you have any doubt, just mention in the comment section. As soon as possible, I see that comment, I will reply to you.
Okay. Understood. I have one more question from my end. What is the difference between ICD 10 and ICD 11?
So basically, ICD 11 is modification of ICD 10. So from ICD 10 to ICD 11, so there is a change in the characters also. Currently, US is not starting using ICD 10, ICD 11, but few countries are using ICD 11. So coding is same process, but for example, if you take ICD 10 CM, you are having 7 characters. Okay, but I think in ICD 10, ICD 11, you are going to have 10 characters. Only characters are different, but all the guidelines are same.
Okay, understood. And the final year students also can go through medical coding training and certification. Then they can apply for the fresher jobs. Correct, sir?
Yeah, of course. Life science is the minimum criteria. So
Criteria.
the people who are having life science background, there is no restriction, so they can apply for job.
Okay.
Yeah.
Excuse me, sir.
Yeah, go ahead.
Sir, I am a student of B Farm final year. I want to ask that my mentors are suggesting me to go for the coding, like to have a better career. So how can I grow in it?
So that is the thing. You need to have basic medical coding training first. Then after that training, you need to take CPC certification exam. Okay. You need to
Okay.
pass CPC certification exam. Then you can try for jobs.
Okay. So is it a good option to get a better job?
So what do you mean better job? First of all, you need to concentrate about your certification. Then think
Okay,
about
sir.
the job.
Okay, sir. Okay, sir. Thank you.
Yeah.
Thank you so much, sir.
Welcome.
Hello.
Yeah.
Yes. Okay, you can go ahead.
Yeah, what is the age criteria for this job applying?
Yeah, frankly speaking, nowadays, so after 30, if you are a fresher, so after 30 years, companies are not taking. If you are a fresher, okay?
Okay.
For example, if you are having the experience, like companies are taking above 40 also.
Okay.
But as time continues, you need to develop yourself. So you
Okay,
need
sir.
to like crack higher positions.
Even in abroad also.
Yeah,
Hello.
as I told you, just you can check our Passport 21 YouTube channel. There you will get all the information related to medical coding abroad jobs.
No, not sir. Even in abroad also, after 30 we can't go for it.
No, I think in US you can go. So that means I
Okay.
have few friends, their age is 45 years. Still they are trying for medical coding job.
As a freshers also.
Yeah, of course. But it is problematic to get the job, but companies will take in US. So there is no age criteria.
Okay.
In India only we are having the age criteria.
Okay, sir.
Yeah.
We have one last question, guys. Which one is better, CPC or CSS for the better growth or career?
So as we discussed previously, CPC is for outpatient coders. Okay. CCS is for inpatient coders. If you want to start as a medical coder, basic medical coding certification is CPC. You need to have your CPC certification. So it is better if you are having the CPC certification, you are having more opportunities. So you can work as outpatient coder or inpatient coder. For example, if you are having the CCS certification, you can't work as a outpatient coder. You need to search for a inpatient coder job. But if you are having the CPC certification, you can work as both. So I think I will tell CPC is better, but after getting few experience, you can work. You can try for CCS also. So there is no restriction. You can avail number of certification. It is based on your interest.
Thank you, guys. Thank you for joining. We are wrapping up the session. Thank you, Harish
Hello.
sir.
Yeah, thank
Hello,
you,
sir.
Sai Kiran. Yeah, go ahead.
Yeah, yeah.
Yeah, this is for Swasa. The question is, we don't have any updated jobs in the app.
Sure, Alakya. We'll be taking it as a feedback. We'll check with our hiring team and
Okay.
we'll post medical coding job because we most will be getting the other job opportunities, doctor, nursing, pharmacist. Medical coding job we will get less opportunities, but still we'll be personally coordinate with our hiring team and we'll share with you.
Yeah, there is no any updations, and after applying also, we didn't getting any calls. So make a check. It would be helpful to.
Definitely, Alakya. That's it for today, guys. If you have any queries, we'll be sharing this video on YouTube channel. It will be available for both Swasa and FastCoder21 YouTube channels. You can watch the video if you miss, or else if you have any queries, comment down your doubts.
Yeah,
We'll
yeah,
be
correct.
answering all the queries.
Yeah.
Also, you can drop your queries on the same mail ID, vincentmedicalcoder@gmail.com, or else you can drop queries on swasa@finompeople.com. Okay, all the links will be given in the video. Will be uploading in a couple of days. Okay. Meanwhile, we'll be sharing you all the course details, course fee, duration, certification details, and everything. Also, if you have any queries, you can follow Harish sir on YouTube as well as Instagram. We'll be in touch with you anytime. Thank you, Harish sir.
Yeah,
If you
thank you,
have,
Sai Kiran.
if you want to suggest anything, you can suggest for
Yeah,
students.
nothing,
Thank
guys.
you for
So if you
listening.
want to like grow in medical coding, you need to have like interest towards the medical coding process. And why means in medical coding we have number of guidelines. Always you need to understand and you need to follow the client guidelines. So that is the secret. Nothing's difficult in medical coding. It is very easy. So we are always with you. So whenever you are having the difficulty, we will try to help you in medical coding particularly.
Thank you, sir.
Yeah,
Thank you,
thank you,
sir. Thank you
Smita.
so much. It was
Yeah,
very informative session, Harish sir.
yeah, thank you,
Uh,
Sai Kiran.
Guys, please subscribe to our YouTube channels, both Swasa and FastCoder21. We will be
Yeah,
sharing you all the details in couple of days.
yeah,
Okay. Yeah. Thank you. Thank you so much. Thank you,
yeah.
guys.
Thank you, guys. Good night.
Thank you.
Thank you.
Thank you, sir. Good night, sir. Happy
Welcome.
weekend.
Bye. You too. Bye.